You know, we are the United States of America, and even though these are different states and different tactics that each of these states are taking, there's no closure of the borders. There is free travel between them, and you may have some of the governors here in the Northeast saying that if you come in from one of these other states, you've got to self-quarantine for 14 days, but there's no way to enforce that. And I know people just around here who are not following that enforcement. What's to say that this is not going to surge again in the Northeast?
Well, I mean, that's the problem, is that we have a lot of infection in this country, so it's going to be hard to keep it out of the Northeast. I think our borders are fairly porous, to your point. And so this is going to be a difficult task for the states that want to try to preserve the gains that they've made, paying a pretty big sacrifice to crush the virus, to have it not be re-imported back into those states in meaningful numbers and see epidemics heading into the fall. It'd be better if we had a more uniform strategy in terms of how we approach this and one mind around it, that we wanted to fully eliminate spread, wanted to really try to crush the virus. At this point, quite frankly, that's going to be hard with so much infection around the country. I mean, we must have well over 700,000 actual infections a day, even though we're only diagnosing about 60,000. It's going to be hard to get to a point where you could, you know, you're not going to eliminate the infection, but get it down to levels that are much, much lower. The prevalence of actual infection in the country right now must be pretty high. It must be on the order of like 1 in 150, 1 in 175 people have the infection right now. Before, when we had come down and we were sort of burning around 20,000 diagnosed infections a day, the conventional wisdom was the prevalence was 1 in 200 people. So now it must be, you know, higher than that.
Scott, that's a pretty strong argument for a national policy. Were you in favor of that? Are you in favor of that now?
Well, we haven't had it, and I don't think we're going to get it. You know, this has really been delegated to the states. It would have been helpful at the outset to have a more uniform approach to how we were dealing with this on a state-by-state basis. We didn't do that, so this has been largely up to the states to implement individual policies. And that's why we've seen a patchwork of solutions and also a patchwork of outcomes. You're not going to be able to unring that bell now that we've gone down that path. So it's up to the states to try to implement measures to hold on to their gains. I wouldn't be surprised to see the states that are implementing things like 14-day quarantines get more aggressive on enforcing those, starting to trace people off of planes and things like that, monitor people off of planes. I wouldn't be surprised to see that start to happen as, you know, these states in the Northeast continue to have relatively quiescent periods right now, and you watch things get worse in the South. You know, remember, with Texas and Florida right now, their healthcare systems really have a lot of residual capacity. About 15% of the hospitalizations in those states are COVID hospitalizations. In Arizona, it's higher. It's almost 25%. That's going to continue to go up. It's going to get worse before it gets better. And I think as you see those states get pressed, I think there's going to be more concern in states like New York, New Jersey, Connecticut, Massachusetts, that, you know, they don't want to head into a fall with carrying more infection that's getting re-imported.
Not sure if you heard us talking earlier about the Big Ten saying that they're only going to be playing games in the conference for the football season coming up in the fall. They did leave open the possibility of canceling that, too. Do you expect to see I feel like we're all kind of sliding towards this resignation that, OK, things are not going to look like normal. We're not going to get to go back to school on a normal basis. I feel like I'm sliding towards resignation that my kids probably aren't going to be playing sports. Is that a defeatist attitude or realistic?
Well, I think that the schools are going to prioritize keeping the classrooms open, and so the extracurricular activities, if they're going to sacrifice something, they're probably going to look to do that and try to focus the resources on keeping classes open, and to the extent that they can keep outbreaks from happening in the school, try to sand away the things that are sort of extracurricular that could potentiate outbreaks. I think, you know, from a sports standpoint, the pro athletic leagues have done a lot to try to create protective bubbles around their players. It's harder for the college teams to do that, although a lot of colleges now are starting to adopt regimes for testing students, and they're going to be testing athletes as well. A number of colleges are talking about testing the entire student population every 2 or 3 days, and they've created pooled sampling to do that. It's going to be harder for the public schools to do that, not because the technology doesn't exist to do it in the capacity. It's there. It's resources. It's expensive, and so local districts are going to have a hard time doing that. You might see, unfortunately, the specter of sort of have and have-nots when it comes to the public schools, because some districts that have more money, that are wealthier, might implement some more stringent measures, including testing, while other districts that are harder pressed don't have their local resources to do it, won't be able to adopt those tools.